Yes, hi, I'm Ioannis Mantzaris. I'm one of the leukemia physicians at the Einstein Montefiore Comprehensive Cancer Center in Bronx, New York. I was the PI in the clinical trial we presented on Saturday on the combination of Venetoclax and 7+3 intensive chemotherapy for patients with newly diagnosed AML. And I'm leading the clinical research effort at our institution. This was an early phase trial, phase 1b study of Venetoclax in combination with 7+3. 7+3 is an acronym for the two different chemotherapeutic agents we use in acute myeloid leukemia for the patients that are young and fit to tolerate intensive chemotherapy. We've been trying to improve upon the results that 7+3 alone has produced for years in this disease by the addition of Venetoclax, which is a pill has been recently introduced in the armamentarium of acute myeloid leukemia. It's revolutionized the therapy for older and fit patients, the ones that cannot take intensive chemotherapy. So we're now taking that advancement from the older patients and moving it to the young and fit patients with acute myeloid leukemia. We're combining Venetoclax and the previous standard of care of 7+3, and we wanted to see how it's going to be tolerated, whether we're going to add additional toxicity or not, and whether eventually it's going to help the regimen produce better results. So what we found in terms of toxicity was our primary endpoint. We wanted to make sure that first is well tolerated. We did not see a signal of increased toxicity by adding Venetoclax to 7+3. We did that in a dose escalation fashion. Such attempts like ours have been recently attempted by other groups as well, and the Venetoclax duration has been variable and in an arbitrary way. So other people have used 7 days or 8 days or 11 days or 14 days. So we did that in a systematic fashion in a way, in a dose escalation, 8 days, 11 days, 14 days. And no matter what the duration we used during the initial phase, we did not see any signal of increased toxicity with adding Venetoclax to 7+3. And importantly then, as the next step, did it work? We did see a significant signal of efficacy. Now, these again are early stage trials and not the large randomized comparative trials, the ones that half of the patients take one approach and the other half are taking the novel approach, and then at the end we're comparing survival, which is what we want to see. Usually this was an early phase trial. We're trying to identify safety and then preliminary signals of the combination working better. And for that we used as an endpoint, a significant endpoint, is the quality of the responses, the depth of the responses. In acute leukemia, we're looking at those bad cells, the leukemia cells, with a microscope, how many of them are left back when we give someone a therapy. And then above and beyond what the eye can see, more sophisticated testing to identify cells at a very low level that could potentially in the future become a problem. And so we call that MRD, or measurable residual disease, and with a central way, so that we can limit operator-dependent ability to identify these MRD. We use the MRD assessment centrally, so one laboratory, so that we can minimize bias from different operators. And we saw very high numbers of MRD-negative complete remission, so high quality remissions at the end of that 7+3 Venetoclax course that patients received. And so this is a signal finding of high preliminary efficacy of combining the two. So I guess that summarizes the results of our study. I certainly hope so, and actually I know so, that it's moving on to more advanced stage of trials. There is this group of trials that is NCI sponsored. It's moving to the phase 2 stage. This is one step further, again with MRD being the primary endpoint to identify efficacy this time around. And in different patient population, 7+3 Ven becomes one of the arms to explore. So certainly is moving forward, and I think it's going to be one of the therapeutic alternatives for future. Maybe it will challenge the current standard of care. Yeah.